Press the bell icon on YouTube and don't miss another update.
Namaskar. Welcome to another episode of Editorial. Today I have a very informative and interesting episode for you. You see, while our country is fighting against the deadly coronavirus, there is one state in our country that has managed to flatten the coronavirus curve. And this state is now almost becoming an example to not only to our country but to the world. And that state is Kerala. Let's discuss Kerala today. Now, before we discuss the Kerala story, let us understand the Kerala scenario. You see, in the last 5 years, Kerala has faced two major floods. Kerala faced Nipah virus in 2018, which was as dangerous as corona, if not more. Now, the first thing is, Nipah virus was successfully handled by the current Health Minister, Mrs. K.K. Shailaja. She is called Shailaja teacher. She was a school teacher before she became a minister. So she successfully handled Nipah virus, number one. Number two, because of Nipah virus, the state government gave tremendous impetus to healthcare, and the state government invested close to 4,000 crores on healthcare in Kerala. So, to a certain extent, Kerala was experienced to handle a virus epidemic, and they also had a fairly decent healthcare infrastructure. Now, the Kerala model can be explained in three perspectives. One has to look at it from three perspectives: the medical perspective, the administrative perspective, and the social perspective. Now, let's start the story. 13th of January, 3 students landed in Kerala from Wuhan province of China who tested COVID-19 positive. So from that particular day, from the 13th of January itself, the passengers were screened before they entered the Kerala soil. Hospitals where people with symptoms were transferred, and people who were tested positive was transferred to the National Institute of Virology. These systems were put into place immediately and fast. So doctors were mobilized, medical kits were mobilized, the infrastructure was set in place. So medically, they equipped themselves very, very fast. Like I said, way back from January 13th. Now let's get into the administrative angle. From the administrative point of view, the biggest step that the CM, Pinarayi Vijayan, took in Kerala was setting up this 24-member quick response team. This 24-member quick response team was headed by Shailaja teacher. And what this team really did is this team coordinated with all the departments in the state. It coordinated with the municipalities, it coordinated with the Jilla Parishad, it coordinated with the police, it coordinated with the emergency services, it coordinated with the hospitals. So this one team was handling the entire show, and because of that, there was easy flow of information and infrastructure. So that's a big decision they took. The second thing that they realized was there was a huge amount of rumors that were spreading, and people were worried. What Kerala did, Kerala immediately started a helpline where people who had misinformation, people who were scared for their loved ones or for themselves could call up and they would be counseled. This worked magic. This worked magic in Kerala because the helpline, I am told, was absolutely flooded with calls, and most of the people were answered and answered well. So that was the second thing they did, and the second thing they did beautifully. The third thing that the CM did way back, I'm talking about way back in January, is he had a meeting with the sanitizer manufacturing company, he had a meeting with the mask manufacturing company, and he increased the production of sanitizers and masks. Now, he realized that sanitizing was one of the most important things. Sanitizing your hand was one of the most important things to prevent coronavirus. So he actually installed electronic sanitizing dispensers across the state. So people could have easy access to sanitizers and could use it whenever needed. So that was the third step. That was the third very important step that he did. The fourth step that he took from an administrative perspective is he started the community kitchens. Now, community kitchen ensured that the migrant workers and even daily wages worker, but most importantly migrant workers, could get 2 square meals. Even Kerala faced their share of problems due to poor migrant workers who wanted to go to their respective homes. But all the same, it was contained to a large extent. Now, from a social perspective, the first thing that Kerala government did is they announced 20,000 crores of relief for the people of Kerala. The second thing they did was they ensured that people were given rice, people were given spices, and people were given oil, so that at least they don't face problem of food, especially the poor class. The third thing what they did is very, very thoughtful of them is, you see, while the school and colleges were closed, a lot of kids depended on the midday meals that the school provided to them. They ensured that these kids were given midday meals at their residence. They packed their midday meals and sent it to their residence. That was seen very positively. And last but not the least, you see, this government ensured that the retired state government employees, their pension date was preponed, so that the senior citizens had cash in their hand. Mind you, senior citizens were the most vulnerable age group for corona fatality. So this group had cash in their hand. So broadly, they took care of all the three aspects. They took care of the medical aspects by ensuring the infrastructure was in place, by ensuring everything happened way back, way early than what the rest of the country did. The second thing they did was administratively, they ensured that the coordination was done perfectly. They ensured that the masks and sanitizers, which was the most important thing for prevention and management of coronavirus, was provided to both the common men and the healthcare workers. And thirdly, and the community kitchen, which helped the migrant workers. And thirdly, socially, they ensured that there was food available to people, and especially for senior citizens, they ensured cash was with them. So this was broadly what the Kerala model is, and this was executed beautifully. Now let me tell you what happened because of that. Because of this kind of handling, today, if you look at some figures, the recovery rate of Kerala is 50% versus 11% of the national recovery rate. The mortality in Kerala is 0.75% versus 3.34% nationally. And if you want to add another statistics, 6.85% of global fatality percentage. The transmission percentage in Kerala is just 0.4 versus 2.6 nationally. This is what the figures are. Let me give you today's figure. As on today, 18th April at 10 a.m., Kerala has a total of 396 COVID positives. Just one number was added between yesterday and today. 255 of them have recovered and they are on their way home. They have only recorded 3 deaths. Like I said, fatality percentage is 0.75. Now, if you look at Indian average, as on today, India has 14,378 positive patients. 992 were recorded between yesterday and today. 1,992 recovered and are on their way home, and 480 of them are dead. So the fatality percentage of India is 3.34%. Now, my 2 bits. It is always advisable to use a successful model and replicate that to the rest of the country. It is always effective and it is always wise. I know the center and the state of Kerala are two different political parties. But if a task team would be set up, if a task team could be set up with somebody like a Shailaja teacher heading it from a national perspective, and the best of officers, bureaucrats as part of that task team, including the DM, the district magistrate of Bhilwara, who did a fantastic job there in Rajasthan. If such people could be incorporated in this national task team, possibly this team could handle the fight effectively. The second point that I want to make here is this entire thing about quick response team that Kerala did to coordinate between departments. I think, at least whatever I am seeing on ground, the biggest problem here is the health ministry coordinating with the municipal corporation doing their own number, the health ministry doing their own number. The panchayat doesn't have a clue what the health ministry is doing, neither they have a clue what the BMC is doing. While each of these people are working very hard, there is no doubt about it, but we see a clear lack of coordination. This 24-member team that Kerala set up as a quick response team and coordinating between them did a fantastic job, and possibly the efficiency of Kerala increased because of that. What we recommend is every state replicate this quick response team and institute this quick response team. This is another point that I wanted to say. The last point that I want to make, and which I make every day, is not so much so the coronavirus as much as we are scared of what is going to happen after the coronavirus. What is life after coronavirus? How will the economy grow? Where will we get jobs from? What will happen to MSMEs? It is imperative that the central government puts up a team together. Team of few of the best economists in the world. Most of them are Indians. Raghuram Rajan, Amartya Sen, Jayati Ghosh. Such people brought together, and we create a think tank that will help us tide over the economic problems that we are going to face, and we are definitely going to face. I think this is one time for Shri Narendra Modi, our good Prime Minister, to ensure that he goes above party line. He becomes a true statesman that his party claims he is. I hope he considers my humble request. Namaskar.
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.